Let's see about the etiopathogenesis and clinical features of cataract and IOL biometry. IOL stands for intraocular lens. First, the definition of cataract. Cataract is defined as loss of transparency of the lens due to degenerative changes leading to its opacification. Cataract is caused by formation of aberrant lens fibers, that is congenital or developmental, degeneration, opacification of the lens fibers which are already formed because of fibrous metaplasia and epithelial cell necrosis, and deposition of other material in the place of lens fibers, that is abnormal products of metabolism in storage and metabolic diseases, drugs or metals like toxic reactions. And this leads to abnormalities of lens proteins, in turn leads to disorganization of lens fibers and loss of transparency leading to cataract. The biochemical process in the development of cataract. There is deposition of other material in the place of lens fibers or degeneration of lens fibers. The actual droplets of fluid or the pigment gathers under the lens capsule between the lens fibers, and this process is called as hydration. So, the droplets or pigments form lacunae between the lens fibers, and then the lens swells. This is called as stage of intumescence. Initially it manifests as myopia, then produces a diffuse reversible opacity. Then there is denaturation of the lens protein, due to which there is dense opacity produced, and this is irreversible. So, this is the biochemical process in the development of cataract. Next, etiology of acquired cataract. Any factor, physical or chemical, which disturbs the critical intracellular and the extracellular equilibrium of water and electrolytes, or which deranges the colloid system within the fibers, tends to bring about opacification. So, the etiologies include age, that is increasing age, systemic diseases like storage and metabolic disorders associated with other ocular pathology, drug or heavy metal toxicity, trauma, infrared light and radiation. Firstly, let us see about the age related, that is the senile cataract. The age changes in lens causes decreased semi-permeability of the lens capsule, producing the formation of cataract. There is decreased production of new lens fibers, increased inactive soluble lens proteins, deposition of urochrome and melanin, decreased function of sodium potassium ATPase pump, due to which there is more intracellular sodium, and because of the more intracellular sodium it draws water inside and there is marked hydration of the lens, and there is less effective antioxidative mechanisms producing oxidative stress. This age related senile cataract is seen in individuals more than 55 years of age, and there is strong genetic association. It appears at earlier age in successive generations. This is also attributed to lifelong exposure to sunlight and UV radiation. The senile cataract is usually bilateral, but it often develops earlier in one eye than in the other eye. The senile cataract can be either nuclear cataract or cortical cataract. The center of the lens is involved, then it is nuclear cataract. The edge of the lens is involved, then it is the cortical cataract. So, this is the nuclear cataract and this is the cortical cataract. The two semilunar shaped cataracts are the cortical cataract. The course of development of senile cortical cataract. The different stages are: first is stage of lamellar separation, second is stage of incipience, third is stage of intumescence, fourth is immature stage, fifth mature stage, and sixth is hypermature stage. This is the stages of development of senile cortical cataract. First stage, the stage of lamellar separation. Here there is separation of lens fibers by fluid, and then there is demarcation of the cortical fibers. This can be seen only upon slit lamp examination. So, this image shows an electron microscopic picture of lens undergoing lamellar separations. So, there is separation of lamella. You can see in this picture. The next stage is stage of incipience in cuneiform cataract. Here there is formation of lens striae, that is wedge shaped spokes of opacity are present with clear areas between them. They appear in the periphery of the lens and lie in the cortex. Symptom is there is loss of contrast sensitivity. So, as seen in this picture, there is wedge shaped spokes of opacity with clear areas between them, and they appear in the periphery of the lens. Next, the stage of incipience in cupuliform type of cataract, which is rare. Previously, we have seen about the stage of incipience in cuneiform type of cataract, which is more common. Now, the stage of incipience in cupuliform cataract, which is rare. Here, there is saucer shaped opacity developed in the central part of the posterior cortex, that is the posterior subcapsular cataract, and this lies in the pathway of the axial rays. So, there is early loss of visual activity in cupuliform cataract. In both the forms, there is progressive opacification which becomes diffuse, irregular. The deeper layers of cortex become cloudy and there is uniform white opacity with progression of time. This is the cupuliform cataract, also called as the posterior subcapsular cataract. The next stage is the stage of intumescence. This is not seen in all patients. In this stage, there is progressive hydration of the cortex leading to swelling of the lens, and this swollen lens obliterates the drainage of the angle of anterior chamber by forcing the root of iris against the cornea. The iris is pushed forward, the anterior chamber becomes shallow, and there is more pressure in the anterior aqueous chamber, producing secondary angle glaucoma. And this lens induced glaucoma is called as phaecomorphic glaucoma. Phaecomorphic glaucoma because of change in shape of the lens. There is swelling of the lens. Next stage is the immature cataract stage. Here the opacification continues as long as there is any clear lens substance between the pupillary margin of the iris and the opacity. This is the immature cataract. Here the iris throws a shadow upon the grey opacity of the lens when the light is cast upon the eye from one side. This is called as iris shadow. So, this is an image showing immature cataract in which the lens is greyish white in color and there is presence of iris shadow. Next is the mature stage, that is the mature cataract. Here the entire cortex becomes opaque and the swelling subsides. The pupillary margin lies almost in contact with the lens opacity and is separated only by the capsule. So, the iris throws no shadow. The iris shadow is absent. The iris shadow is present only in case of immature cataract. Here, as seen from the picture, the lens appears pearly white in color. Next is the hypermature stage of cataract. This sets in if cataractous process is allowed to go on uninterruptedly. This is of two types, the Morgagnian or Sclerotic type, based on the pattern of lens changes after mature cataract. The two types of Morgagnian and Sclerotic cataract. These are the two types of hypermature cataract. The Morgagnian hypermature cataract. Here there is suspensory ligament degeneration due to which there is subluxation of lens. The cortex becomes liquefied and milky white in color. The nucleus sinks to the bottom of the lens. So, it appears as a brown mass limited above by a semicircular line and it alters its position with changes in head position. This is Morgagnian hypermature cataract. The other type is the Sclerotic hypermature cataract. Here there is disintegration of the cortex, so the lens becomes inspissated, yellow in appearance. This is also called as shrunken cataract, due to which the anterior chamber becomes deep and the iris becomes tremulous. So, the tremulousness of iris is called as iridodonesis. The capsule develops calcium deposits. It appears wrinkled, thickened due to proliferation of anterior cells. So, there is dense white capsular cataract may be formed in the pupillary area. This picture shows a sclerotic hypermature cataract. There can be phaecolytic open angle glaucoma as a result of hypermature cataract. Let us see how. The capsule develops small pores due to which the liquefied protein material comes out of the lens, and this is engulfed by macrophages. The cells are swept into the trabecular spaces by the normal current of the aqueous, and these cells block the exit of aqueous humor from the eye. So, these in turn lead to phaecolytic open angle glaucoma. This is also secondary glaucoma. The features of it are, it is acute in onset, there is monocular pain and redness, high intraocular pressure, conjunctival hyperemia, corneal xerosis, that is dry eyes, white material is seen in aqueous humor, the corneal endothelium anterior lens capsule have calcium oxalate or cholesterol crystals. Until now we have seen about the senile cortical cataract. Now let us see about the course of development of senile nuclear cataract. There is central nuclear sclerosis. So, the nucleus becomes inelastic and hard. This occurs soon after 40 years of age, and it typically blurs distant vision more than the near vision, and there is decreased power of accommodation and obstruction of light rays. The visual disturbance, there is second sight. The second sight is because of blurring of distant vision more than the near vision. So, the patient can see the near objects clearly. This is called a second sight. In maturity, the sclerosis extends to the lens capsule. The entire lens functions as nucleus. The progress is usually very slow, and hypermaturity generally does not occur in case of nuclear cataract. This image shows a nuclear cataract. The course of development of senile nuclear cataract. The color changes in the nucleus are because of the deposition of yellow pigmented proteins, derived amino acid tryptophan, and they are altered by action of sunlight. So, the different grades are NS1 plus, in which the nucleus is clearer than the anterior or posterior sections. NS2, nucleus sclerosis 2 plus, the nucleus equals to the anterior or the posterior sections, same opacity level throughout. NS3 plus, the nucleus is denser than the anterior or the posterior sections. NS4 plus, the cataract is completely opaque or brown in color. There is high level of pigment deposition, so the pupillary reflex is entirely blackened. So, the 4 grades are nucleus sclerosis 1 plus, 2 plus, 3 plus and 4 plus. So, this is all about the senile cataract, both senile cortical and the nuclear cataract. We will see about the other types of cataract in our next video. Thank you.